Respiratory Therapy Week starts Sunday, October 20th. This is a time to recognize and celebrate respiratory healthcare professionals. Tracy McCullough, Clinical Supervisor at Niagara Health, is in the studio here and joins me. Thank you so much for joining us today, Tracy.
Thank you.
Why don't we start off by explaining what is a respiratory therapist?
Respiratory therapists are RTs. We work in hospitals or in home care settings. Some work in clinics as well. We have asthma clinics, COPD clinics, and pulmonary function clinics. And then in the hospital, we work throughout the entire hospital, anywhere from the emergency room to the NICU to the intensive care unit for adults, and anywhere in between. We're very highly utilized in the labor delivery unit, emergency room, and intensive care unit.
So let's describe specifically. So respiratory, we're trying to get air to the lungs. Very important. What are some of the ways that you do that?
So the RT might be consulted on the wards from a nurse who's having trouble getting a patient's oxygen levels up. And we can do that with anything from nasal prongs, just little tubing that goes across the nose, all the way up to a mask that will breathe for them non-invasively, to actually inserting a breathing tube in through their throat to their lungs to deliver that oxygen with a mechanical ventilator.
Let's talk about the need for this service. How important are respiratory therapists within our healthcare system?
I'm a little bit biased, but we're extremely necessary. Anytime there's an airway emergency, the RTs are called, and airway is vital to life. So they're extremely necessary. I don't think any unit could function without their support.
And I think that the general public became a little bit more aware of who respiratory therapists are and what they do during COVID.
Yeah, the COVID pandemic was good PR for us, but also a really difficult time for the RTs. We were very short-staffed, very utilized, and very recognized for the first time, I would think. Yeah, a lot of people didn't know what we were until that pandemic, when we were worked really hard.
Yeah, absolutely, and thank you for everything that you and all the other respiratory therapists did during that time. Let's also kind of back it up to, you said it starts a lot of times in the NICU. Mm-hmm. So, why don't you just describe that a bit?
Yeah, so the RTs are called for any high-risk delivery. If there's anything abnormal happening, from a cesarean section being necessary to the fluid not being clear at birth, RTs are called, and RTs will receive the baby immediately after birth, do their assessment, and intervene as necessary as that infant transitions from in utero to life outside of mom. The RTs are there for them and they support them, and then we'll follow that baby in the NICU if they are admitted.
And I have a bit of a personal connection to that and very much love respiratory therapists. My son Zach was born at 32 weeks and needed the CPAP machine. He looks back at the pictures now and he had all the tubes, and explaining to him, that's not scary, that was necessary, they saved your life. And now he almost brags about it. He loves seeing the pictures. Yeah. And I was really excited to hear that now at Niagara Health you can, what was the age now? The gestation, 30 weeks? Now?
Yeah, from 30 weeks onward, we'll hold those babies here in Niagara now. We don't have to ship them out to a bigger center. And so those babies on CPAP can stay here closer to home. We have a really nice NICU with individual rooms, space for parents to stay. And we just opened up a Ronald McDonald room too.
Wow.
In the hospital.
Having stayed there for 3.5 weeks, I would say it is top notch, and that's so exciting to hear, about the advancements here in Niagara. Something definitely to be proud of. If someone's, say, interested in maybe becoming a respiratory therapist, what advice would you have for them?
So it depends on how young they are. If they're still in high school, I would suggest take all your maths, all your sciences, any healthcare, like if you have human kinetics at your school or phys ed, take those courses. And then into college. It's a difficult program to get into. It's pretty competitive because there's not many schools in Ontario, but it's a 3-year advanced diploma program at college. 2 years are in school, and then the 3rd year is all in the hospital learning on the job.
And you've got 15 years under your belt, and you still love it?
I love it. Yeah, it's a great job. When the physicians need you, they call you and you feel like the hero. In between, we have some routine things that we do, and it's pretty low stress, but you get the adrenaline rush, you get the busy day-to-day, and no day is the same as the last one.
And what specifically with Niagara Health are you doing to, celebrate respiratory therapist members?
So coming up at the end of October, we're doing a few learning opportunities where we have different reps come into the hospital and teach us about new equipment or new practices that are out there. And then we'll go out together as a group. We're going to go axe throwing one day, and we'll go out for a dinner another day.
Good. Well, we all celebrate you, and really all of the medical staff here in the Niagara region. So thank you for joining us, Tracy, and we'll be back in touch.
Okay, thank you for having me.